Hello, and welcome to The Spark, a view of innovation healthcare. I'm Rachel Schreiber, your co-host, and in this episode, we're speaking with Anna Taylor, AVP Population Health and Value-Based Care at MultiCare Health System, and Heidi Kriz, Director of Medical Policy and Medical Management at Regence Health Plans. So I first heard about your collaboration on using FHIR for prior auth at Vive in 2022. I was really impressed with what you're doing. And then the conversation that the two of you had on the Dish on Health IT podcast was really interesting. So, if any of our listeners want to go back, that podcast is still on and available. So I'm really excited to hear more about what you're working on. And it's been about a year to 2 years since I last heard about what you've been working on. And I know you've got some great results. So I'm really looking forward to our conversation. And today I'm also joined by Joe Rostock, Chief Information Officer at FHIR Health.
Thanks, Rachel. Welcome to The Spark. And Heidi, we really appreciate your time. We're really interested in hearing about your approach to innovation in healthcare and what you've learned from it. But before we talk about that specifically, let's go into your personal passion in healthcare, as we like to call it. What's your spark? And let's start with you.
Thanks, Joe, and thanks for having us here today. We really appreciate the opportunity to speak with all of you. My spark comes from something that I think has been inside me for a really long time, which was I felt like I needed to leave the planet a little bit better than I found it. And I have, since I can remember, felt that way, that I have to do something. I got to work hard and make something happen. And when I was young, my mom reminds me that the two things I wanted to be in life were a teacher or the president of the United States. So you put mush those things together and you get this, which by trade, I'm a UX engineer and trained in human-centered design. And I just have a true passion to help people and to make things the best experience that you can ever have. I'm the person who goes into any place, a restaurant, a bank, and I'm like, ooh, if they moved that over there and this here, then it would do this, and the people would be so happy. And so I'm constantly thinking about ways to make experiences better and more joyful, because that's what I really want to leave on this planet, is just the joy of life and being human. And I think it's a real beautiful thing. And the other thing that gets me up in the morning is I love working with people. I love seeing them succeed. I love bringing teams together and watching them achieve great things. And you cannot change the planet without a team of people. So I just have this passion to watch people discover new things that they might have a talent for and then give that gift back to the world. So those are the two things that really get me up in the morning, get me going. And you can apply those to many things. Healthcare is what I fell into, I will say, accidentally, but I don't think it was a mistake or anything. I think it was my destiny to be here. So that's what my spark is.
That's fantastic. Thank you. Heidi?
Thanks for having us on the podcast. Really excited to share our story and a lot of what we're doing today and catch you up since we launched in 2022, the FHIR-based prior auth workflow. My spark is really around the fact that I love healthcare. I love nutrition. I love using evidence to inform on practice. So I started off early wanting to be a dietitian. And so that's where I started my career. I worked inpatient and in an outpatient clinic and really loved being part of the healthcare system and seeing the impact that it has on people's health and well-being and really quality of life at the end of the day so they can live, their best life. Through that work, my spark really came in using evidence to inform practice and policy. And that's where I really started to jump off and think about a different career in healthcare, from being a dietitian then to getting my master's in public health and thinking about how do I really impact a population versus an individual patient that I might have been seeing at that particular time. So my spark got really excited when I knew I could go back to school, get a master's in public health, and really work on a population level, impacting healthcare, but also really largely trying to, impact policy and other things that could really move the nation. And so it was really interesting for me to start working at Regence and really being involved in the prior authorization process and seeing just how administratively burdensome it was for everybody involved. It's burdensome for the health plan as well. So that was my spark. I started to think outside the box, and I love to be innovative. I love to think of different ways to do things. And like Anna said, love to work as part of a team. When you have a team of people around you, it's amazing what you can accomplish. So
That's really great. Thank you. I love that I want to be a teacher or president, Anna. That's really awesome. All right, Joe.
Yeah, so let's dig into the solutions that you're working together on a little bit. And I think one thing we could all agree on is, given the complexities in healthcare, it takes collaboration and it takes working together to, really figure out what's the best solution and what the impact of that solution is going to be. So we'd like to hear about how your teams specifically are collaborating on administrative processes to drive better outcomes. So Heidi, let's start with you.
yeah, so we started down this pathway, I would say, really heavily in 2017. Really thinking through all the different ways we exchange clinical data between, a payer and a provider. And there's so many different ways we do that. And in addition to that, right, there's different data standards. We make the providers go out to different portals for different reasons, and leave their native workflow. And so for us, we could see the administrative burden that some of the processes were having on our providers, but also we have to intake that data in different formats and from different places, as well. So it sits on both sides of the fence of just a lot of opportunity to make change in this space. For us, we started with prior authorization because we felt like that was an absolute area that needed change. And at the end of the day, that impacts, right, the people, the patients, the members on the health plan. How do we get them care as fast as possible? And that was really, I'll use the term spark again, in our organization. So our CEO at the time really challenged us to say, how do we, have our members get the care they need and not have to feel the prior authorization process? And that was what kind of triggered us to really start down the path of prior authorization, but also at the same time realizing that as FHIR was coming on board and the Da Vinci Project was starting, we've got a huge opportunity right now in this point in time to really lead the nation. And like I talked about, there's a team of people coming to the table to really solve for this. And it's much bigger than just prior authorization, but that's where we had chosen really to start. We have a couple of use cases. I'll let Anna maybe speak to the other use cases that we have as well using FHIR. But for us, we could see that if we could really meet the provider where they're at in their native workflow, and have that direct connection, we can really start to automate the process and really build off of that foundation and then use FHIR for other use cases. Because at the end of the day, it takes the payer and the provider coming to the table together and collaborating. If one of us comes and the other one doesn't, we don't move the needle at all. So, and I'm going to
That's
turn it
great.
over to you to maybe talk about a couple of the
yeah.
other use cases. That'd be awesome.
Yeah, I'll talk about those, but I'll also share that this was an opportunity for two separate businesses to share an operational process. So much like we do that in the grocery store, banks share an operational process with grocery stores. In trading, financial trading, all of the companies that it takes to verify, do things, they're collaborating in this space to make those business transactions happen. They're sharing operational workflows instead of being siloed identities. They're coming together to say, hey, if we want to service our customers in the best way, we got, this is something we're not going to compete on, which is trading your money or whatever. So one of the most important things in healthcare that we don't do a lot of is that we don't collaborate. We are a walled garden sometimes when it comes to where our data is stored and how it works. And this was a business problem when it comes to providers taking on financial risk. In order to do that, we have to collaborate with more parties than we had before because care just happened inside your garden. Now care is happening out in the community. And it takes a village to maintain an individual's health. So it's really a shift in mindset to think about sharing operational processes with all the stakeholders in the healthcare ecosystem. And those other use cases we're putting into place are also quality measures exchange. So in order to trade our data to tell our health plans that we're closing care gaps and making sure people get their mammograms and their colonoscopy screenings, we have to tell them through data. And that data is usually exchanged in flat files of many different flavors and kinds. And so we worked together with Regence to figure out how we would exchange that using the same technical infrastructure that we did with prior authorization. And again, that came back very fruitful for us. And so we are really excited about continuing to put those use cases in place and also scale those use cases in what we call a networked FHIR modality.
That's great. So, Anna, I'd like to stick with you in this next question. So the work you're doing is transformational. I think you can, see that in the results that you're achieving. But many times these kinds of changes within organizations are competing with other priorities in the business. Kind of looking within your company, like specifically, how were you able to make the shift to make this a priority and, over and above everything else that's happening in the business, get their attention, everyone's attention, and the support you needed to do it?
It's a great question because it's something I actually don't get asked that very much. So thank you. I think that it's an important one because the first thing we did was I've worked for MultiCare a long time. So I have friends who I would call and be like, hey, what do you think about this? What do you think we could do this? Kind of that team I'm talking about of people who want to learn with you and also see if we can enhance the business and really care about our success as an enterprise too. So the first thing that happened was we identified this business problem that trading data in population health is really hard and it's not sustainable. And if we're going to do this and succeed in it, we got to get better at trading data. So first there was a business problem. Then we said, hey, these partners, Regence, wants to talk to us about trading data differently. And I'm like, yes, because I have a business problem for which I need to trade data in a different way. So we said yes. And then those colleagues that I said took that yes thing too, said, yeah, I think this could work. And so that work turned into a small pilot to say, let's try to solve this business problem in this small way. It cost me about $15,000 to try this pilot out. And that particular pilot was around quality measure exchange. So one quality measure, which was 30 days post-discharge med reconciliation. And we exchanged that using a FHIR payload to give that data on a more frequent basis to Regence so that they knew what our gaps in care were on a more frequent basis too, which enabled us to know who we're calling, not duplicating resources. And then as a part of being in a value-based care contract, you get reimbursed for closing those gaps in the model. So overall, that whole piece of technology and implementation gave us about $17,000 back in financial reconciliation when it came to that value-based contract. And so 15,000, 17, I'm already paying for the development. That development can be used again year over year. And we submitted that to our company's best practice system, which is called the President's Award. And it won the award. And because of that attention, it was enabled to get funded through other partnerships that we had and other payers who are interested in exploring trading data in this way. So because we had some enterprise buy-in that, hey, you did all that without touching the provider workflow and bothering us. I'm like, yeah, it's data trading. Yes, we did. Can you do that with other things? And so the trust was earned with the enterprise, and we were able to start collaborating with other business units like Red Cycle to get prior authorization off the ground and explore if the same return on investment came through that methodology, which it did prove itself out to do the same type of return and probably even more in efficiencies.
That's great. That's a great success story. Heidi, what are your thoughts on this within Regence Health Plan?
Yeah, for us, I talked about it a little bit earlier, but just to kind of jump off of where I had started, we really do serve our members, right? First and foremost. So for us, it was really about the member story and how do we get them care that they need, if not instant, as fast as possible. And so that was really where everything started for us. And that was really the value for Regence, was really focused on the member. But by the way, right, it's administratively burdensome for the health plan and the provider. So it's just a win-win for everybody. When we started down this pathway of prior authorization, I think through the prior authorization work, what was really exciting is, right, you can use these FHIR APIs for many different use cases, not just prior authorization. But what it allowed us to do is really from a leadership level, from the very top down, influence the organization to say, this is truly transformational. This is going to make the process better for everybody. And by the way, we can start to do this with other use cases, just as Anna was saying, that impact the health plan and ultimately the operations, but most importantly, the member. And so I think prior authorization was really our jumping off point for the most part. And then we were able to do a few of these other use cases with Anna and a few other organizations too. And really start to move the needle is, as Anna said, with our leadership to say there's value in this. And we have to change how we do business today. And this is really the movement. And we've got to get with other industries that do interoperability very well. Like Anna mentioned, the banking industry. Healthcare has got to change and it's got to move that direction. So I think prior authorization was really that momentum and jumping off point in our organization to really start to educate our leaders on the value of using FHIR and the direction that we can go. And now we're able to start to talk about other use cases and then expansion and getting support for that.
That's fantastic. Yeah, the complexities around the term interoperability are pretty persistent in healthcare. And I think the results that you're seeing are significant in the sense that it takes this intangible term and makes it real, right? Not just the interoperable capabilities, it's the results from it. What other use cases based on this ability that you've created, what other use cases are you thinking about that are based on FHIR, that are based on the results you've seen? What's like a natural evolution of the work that you've started to dig into next to kind of, as I've heard you refer to it, replumb the backbone of healthcare? Like what other use cases are you thinking about?
Well, I can start with that one. Yeah, this is the electrical grid of the future. That's absolutely true for healthcare. As we think about the enhanced use of augmented intelligence, I'll call it augmented intelligence, not artificial, is that if we want to plug those things into workflows, we have to have interoperability. So as we've been proving out quality, let's trade quality data, some like basic ABCs of healthcare. Let's trade identity data so we can match patient records. Let's trade different use cases that are basic foundational provider data. You need these basic types of data exchange in order to calculate in healthcare. And our augmented intelligence is the calculator. And the reason why it's an amazing calculator is it can calculate immense amounts of data in times that humans can't. it absolutely enhances our human capabilities. And if we want to be able to give and feed those machines to help us understand different insights that we might not always see as humans and the way we compute information, we have to be able to get it there efficiently and effectively and securely. And so as a part of the smaller use cases we've put into place, like exchanging lists of populations or registries, exchanging lists of quality data, exchanging prior auth. We're also looking into exchanging surveillance data. So we have chronic disease management compliance that we have to report on. We might have to report on available beds. We might have to report on COVID, the next pandemic, which I hope not to live through. Like, I think that's going to be way past my time. Hopefully, but it's the way for which we compute. And in order to take advantage of the compute power that's available to us today, we have to get more efficient at trading data. So we've really invested at MultiCare in an infrastructure that enables us to do these API trades and have RESTful APIs with data at scale on cloud-based computing systems so that we're enabled to do this for all the use cases of the future.
That's great. Fantastic. Both the clinical and administrative workflows are benefiting from this, obviously. Heidi, your thoughts?
Yeah, I would say that our thoughts are similar to what Anna said, very, very similar. I think our providers are very interested in prior authorization in this space. As she talked about, identifying populations that are in alternative payment models with us and really being able to identify those within the EMR is another big use case that providers are interested in. So all the same use cases. It's just a matter of, right, where do we prioritize and what do we do next? I would say the one more thing I would add in is we're evaluating doing inpatient reviews. So right now, a lot of people are focused on elective prior authorization, but there's a lot of reviews that happen while somebody is in the hospital. So how do we take advantage of these workflows and capabilities and now add in that workflow as well for patients that are in the hospital and really try to be more transparent upfront and collaborative in how we think about that hospital stay and ultimately, right, what gets paid and not paid at the end of the day.
Well, that's exciting for me. We would love that, Heidi.
I know. I'm working on it.
So as a wrap up, what key phrase do you use to describe the vision of what you're creating both at Regence and MultiCare?
My key phrase, and I have it in my slide deck when I present, is "the future is now" with a big exclamation point afterwards.
Yes.
I will tell you that as I present on this work and what we've done and accomplished, I think at the beginning people are very skeptical. They don't believe it. They say, "Oh, that's 10 years down the road." I actually got that comment last week from a provider. And I would say the future is now. We can really make a change right now. We've got the infrastructure. We've got the use cases. We can make a change. So let's all come to the table and start collaborating. We've all got to stop sitting in our silos and saying, you health plan need to do better, and the health plan saying you providers need to do better. Let's come to the table, start talking to each other and start collaborating and really start to break down the silos, build trust so we can create change. Because like I said, if we don't come to the table together, nothing is going to change. And that's what it's truly going to take. So for me, it's the future is now. Let's do it. We don't want to be the only payer in the Northwest doing this. We want other payers to come to the table, and we want other providers to come to the table. So the future is now.
That is so inspiring, because I was listening to you and thinking, like, this is so important and it needs to catch fire. Well, that's a really funny joke that I just made, but on accident. But it does, because we can't continue to operate this way. It's not scalable, or we see it's not scalable, and it's really difficult and complicated, and it's impacting everybody negatively. So Anna, what is a key phrase of the vision of what you're creating?
I would be remiss to say this isn't all for the patient. Like, this is all for you guys on this podcast, for my two small humans, for my parents, for the communities we live in. This is all to bring that joy to healthcare for everyone who has to be in it, and that is all of us. And so my catchphrase is be curious and be brave, because new things are going to come to healthcare all the time. This is just one more new thing. And instead of being fearful of something that's new, ask questions, see what it is, be curious about what makes you, what it could do for healthcare. Could it bring more joy? Could it make it better? And maybe it can't. Okay, well, you've explored it, you learned something. And I think I know that's something Heidi and I share, is a passion to learn new things and understand new things, as all the time we spent together. And the other part is to be brave, because we all have braveness in us. And sometimes it does take risk to try new things. And with my team, exploring and giving that permission to fail and fail fast is really important. And I think same for the collaboration we have with Regence, is we had to learn how to fail fast. Okay, that's not working. Let's try it this way. All right, this is working. And having that mindset and culture that it's okay to do that, so that we can get to the best answer for the nation and for the people and the humans that are served by healthcare every single day. So be curious, be brave out there. You can do this.
Be curious, be brave. That's really great. So I admire the work that Heidi and Anna that you're doing, and the collaborative approach, because I know that you could have maybe tried to figure out this on my own, and then but working together, you've clearly come into a way that's going to work better for healthcare. So I really admire that. And healthcare definitely needs more leaders like you, and keep the work up. And let's hope this catches on fire.
Pun intended. Pun intended.
Pun intended. So if our listeners would like to keep up with your thought leadership, you can follow Anna Taylor and Heidi Kriz on LinkedIn. You can find them easily on that platform. And thank you for joining us today, and continue that transformational work in healthcare.
Thanks so much for having us.
Yeah, thank you for having us and helping us spread the word and the passion.